Are you worried about Alzheimer's or dementia, either for yourself or someone you love? Well, then this message is for you. Scientists are learning that the immune system plays a bigger role in brain health than we once thought. And believe me, there's a lot you can do to support your immune system. Hi, I'm Dr. Krystosik, and in simple terms, let me explain how the immune system plays an important role in Alzheimer's and dementia. There are tiny soldiers that are part of your immune system. There are stations in your blood, and they're called antibodies. And sometimes they can react to certain brain-related proteins. And when that happens, it can add to fuel or fire the loss of memory, and then you can end up with things like dementia. The good news is the lifestyle medicine that we prescribe here on the other side of medicine, well, things that we eat, how we move, sleep, handle stress, and connect with others can calm that fire down and protect the brain. In some people with early symptoms, intensive lifestyle changes have even improved thinking and daily function, and there are clinical trials to prove it. So, what are antibodies and why do they matter? Antibodies are part of your immune system, and normally they help you by tagging germs so your body can clear them out. But sometimes antibodies become confused, and then they can start reacting and damaging your own body or the proteins in your brain that you use every day. And when they do, it can trigger inflammation. And believe me, inflammation, if it hangs around for some time, it can start to damage those brain cells. And researchers have found that people with Alzheimer's disease already have antibodies. And that's your body's own natural defense proteins that can spot the bad proteins inside the brain. Well, the bad proteins are called amyloid beta and tau. And they are main ones that clump together and damage the brain cells in Alzheimer's. And the immune system is trying to fight off Alzheimer's by making antibodies that recognize the harmful brain proteins. Well, some of these antibodies may even be the body's attempt to clean up sticky proteins, but on the other hand, others might worsen inflammation. It's a mixed story, my friend, but it tells us that the immune system is deeply involved. What you see in my patients who have dementia or early signs of Alzheimer's disease, or those who want to prevent those things from occurring, I do a simple blood test that measures antibodies to what are called 7 groups of proteins and peptides that are linked to brain health. These 7 groups include proteins that help build brain cells, molecules that support growth and repair of cells, nerve and enzyme particles. We're looking for certain microorganisms and harmful chemicals, and also some foods that can confuse the immune system and act just like amyloid beta and proteins that allow harmful particles to bypass the barrier between the blood and the brain. We call that the blood-brain barrier. And when the immune system reacts too strongly to any of these, it may add to the risk of dementia or Alzheimer's. Well, this type of testing teaches us an important lesson. Protecting the brain isn't just about using a drug to eliminate the plaque. It's about keeping the immune system balanced and the brain's protective barrier strong to get those underlying causes out, while the cause of why the plaque is forming. Well, what does the latest lifestyle medicine research show? Well, a landmark randomized controlled trial led by Dr. Dean Ornish, who, by the way, has been a guest on my podcast, he looked at the people with mild cognitive impairment and early Alzheimer's. See, one group followed an intensive lifestyle program. They ate whole food. They followed mostly a plant-based diet. They did regular exercise, stress reduction practices like meditation and deep breathing. They had strong social support. And they did take a few basic supplements. Well, over the 20 weeks, many participants in the lifestyle group showed better scores on thinking tests and daily function compared with those in the control group. This is the first randomized trial to show that comprehensive lifestyle change can help people who already have Alzheimer's disease, offering them real hope. Now, there are other medical studies that point in the same direction, because lifestyle medicine that combines nutrition, movement, making sure you're getting a proper sleep and mental engagement protect the brain by lowering inflammation, improving blood flow, and in supporting the brain's natural cleanup systems. And there are early animal and human studies that suggest specific dietary patterns and even short cycles that mimic fasting can reduce brain inflammation and support healthy protein clearance. How can lifestyle management lower harmful antibodies or their effects? Well, let's keep this at an easy level so you can understand. Think of your brain like a busy city. Antibodies are like traffic officers, and they're helpful when they're doing the right job, and they're harmful if they start pulling over the wrong cars. You see, lifestyle medicine doesn't just erase antibodies like flipping a switch, but it can change the whole traffic system, lowering body-wide inflammation and the anti-inflammatory food patterns that are found in colorful plants that are fruits and vegetables and fiber and legumes and nuts and seeds and omega-3 foods that are rich in fish, cold water fish like salmon and sardines. They and give your gut microbes the fiber that they need for short-chain fatty acids. These are the natural compounds that calm the immune system so that the body doesn't overreact. So less alarm in the bloodstream can mean less immune misfiring towards the brain proteins and causing amyloid plaque. Strengthening the blood-brain barrier and regular exercise and getting proper sleep and proper blood pressure control can help the brain's protective gate from becoming too leaky. A healthier barrier may limit the contact between circulating antibodies and the delicate brain tissue. Now, improving protein cleanup is done by simple measures like good sleep and the body's cleanup system called the lymphatic system. It's a nightly rinse cycle that helps to clear waste, including damaged protein. And then there's stress reduction, which lowers cortisol levels that can worsen inflammation and disturb your sleep. And then movement boosts blood-derived brain factor, the neurotropic factor called BDNF, which supports healthy nerve cells. And balancing the immune system response is important. Early research shows that certain nutrition patterns and fasting can mimic cycles that tune the immune system and lower inflammatory signals inside the brain. And while this doesn't delete the specific antibodies, it can reduce the damage that they cause. Now, if you or a loved one has memory changes, talk with especially a qualified functional medicine physician about a comprehensive plan. Ask about lifestyle programs, coaching, and community support. We have the Gut 911 prescription community that are people just like you that are supporting each other. They're supporting each other on the road to good health. And consider getting the appropriate testing as part of a full workup by a functional medicine practitioner. I'd love to be able to help you with that if you're so inclined to do so. Well, most of all, start with some small steps today. Take a walk. Add an extra cup of vegetables. Call a friend and get some support to help each other out. Or go to bed 30 minutes earlier. You see, small daily choices add up, and your brain is going to be able to get support it needs to be able to prevent Alzheimer's disease and dementia. Well, my friends, I encourage you to follow us on social media, listen to my podcast, The Other Side of Medicine, and join our group, the Gut 911 prescription, and you can really get the help that you need and the support that you need. So until next time, here's to your health.